Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I want to talk about thumb pain. Thumb pain is very often easy to fix. I say fix because you'll see it lasts a long time when you work on someone with thumb pain. And I'm talking about even people over 60 or 70 who have been told that they have arthritis of the thumb. Now, I'm not going to say this applies to things like rheumatoid arthritis, even though you can definitely help with pain from rheumatoid arthritis. But I'm just talking about basic either osteoarthritis of the thumb joint or basically what I would call an overuse tendinopathy of the thumb, which happens in people of all ages. You'll see younger people now, because of phone use and typing with thumbs, you'll see thumb pain even in people in their 20s. So and thumb pain is very treatable with acupuncture. I mean, when I say very, I mean it responds really quickly in one visit. Sometimes you need two, but very often it's one. I'm thinking of one case that needed more than one treatment, and I followed up the chain and found that there was some radial nerve involvement in the tricep and the thoracic outlet. And once that was addressed, the thumb pain was able to resolve and stay better, and has stayed better for many, many months. I still see the same patient, and we don't work on the thumb. So thumb pain, if you happen to be over 40, most of the time you'll just be told that it's arthritis, and you'll be given some sort of, instructions on either bracing or anti-inflammatories. Some people might end up getting injections or doing physical therapy for thumb pain. And acupuncture can absolutely correct the muscle imbalances that are causing the joint pain very rapidly. And I've done an episode on de Quervain's tendinosynovitis, so I'm not going to talk about that too much. That is just abductor pollicis longus and extensor pollicis brevis tendons that get inflamed, and that if you treat those two muscles, you get very good results. But what you'll see is people get thumb pain at the base of the thumb or at one of the metacarpal phalangeal joints, distal interphalangeal joint, etc. And this can be addressed by working on extensors and flexors of the thumb. My go-to for things that look like extensor is going to be the extensor pollicis brevis, extensor pollicis longus. But a lot of the pain you'll see from repetitive phone use is going to be flexors in the intrinsic muscles of the hand. So you're going to get into the adductor pollicis. You're going to get into the abductor pollicis brevis. You're going to get into the opponens pollicis, the adductor pollicis. What am I thinking? Flexor pollicis in the palm. There's a little web adductor of the thumb between the thumb and the index finger where the Chinese acupuncture point, large intestine 4, is. That's a little web of a muscle that adducts the thumb, and that can cause pain at the base of the thumb, and it's usually on the inner part, close to that LI4 area. But the repetitive use you're going to see is mostly going to be flexor pollicis brevis, abductor pollicis brevis, or opponens pollicis. And those three are sometimes all involved. But the great thing is use a thin gauge needle, use your thumb to distract, dig your thumbnail in where you're going to tap the needle. You're going to use a tube and you're going to tap a super thin gauge needle there. And it's most of the time it's pain free. Now, the hand is very vascular, so be prepared for a little drop of blood on at least one of those needles. Have your cotton ball ready for pressure, have some arnica. It's well worth a little bit of a bruise there to get these muscles fixed, and then they don't have to have physical therapy or an injection or cortisone injection. This goes across the board. I treat thumb pain so regularly and so quickly. I had someone come in for an emergency back pain, and she said, "Do you have a minute to look at my thumb? Do we have time?" And I said, "Yeah, thumbs are quick. Show me what's going on." I released like 2 or 3 muscles in, I don't know what, 3 minutes, 4 minutes. I did it one at a time, stimulating each needle with the pointer Excel pointer device that I use with electric stim, until I saw movement of the muscle increase. And then I knew that the muscle was reset to its best elasticity. Take the needle out, move to the next. I think it was 3. Maybe I probably did the extensor pollicis brevis as well, just because I feel like even though that didn't seem to be causing her pain on the back of her thumb, I think that as an antagonist is important. Just like you'll see the extensors of the fingers getting tight can affect the grip strength. They are important agonist antagonist relationships when you're thinking about fingers. So fingers and thumb. So I did do the extensor pollicis brevis most likely, just like I said. So it's not inhibiting flexion and maybe leading to this repetitive injury coming back. And it's just on her right thumb. I'm pretty sure it's phone use. This is a really common issue, and you need to know that it's super treatable. And you just have to know your motor point locations. Most of them are about halfway in the belly of the muscle, right in the middle. So if you just, you don't have time to look it up, palpate what seems tight and sore and put a needle in it and put some electric stim on it. You're very likely going to get it right. So, maybe you don't have time to, but, if you look at the Peroto electromyographer book, it has great locations for all those thumb muscles with great drawings to help you figure out where you're going. So, check that out. There's really no reason that people should have to live with thumb pain. It's super treatable, even when they're told it's arthritis. I do this I have a 90-something-year-old patient that I recently addressed the thumb pain of, and it was just like a random fact. And I said, "Have we ever tried to treat that?" And the patient said, "No, I don't think it can because it's arthritis. And, I sew a lot and I knit. And it's just gotten, it's been really painful lately. It's been hard to do anything like that." And I said, "Let's see what we can do." And sure enough, knocked it out. No pain. Even helped a different finger that wasn't closing all the way. I'll talk about that another time. But this stuff is totally fixable. So no excuses. Palpate and needle, and use a thin gauge needle, and use your electric stim. If you just have a pointer, do one muscle at a time, like 30 seconds to a minute on each muscle. Take the needle out, move to the next muscle. You can fix thumb pain in like 5 minutes. So just wanted to put that out there. It's probably not something I've talked about too much, and it's something I take for granted, and I probably assume that because it's so simple that everybody knows this. But sometimes, I realize as I go abroad and teach different places, things that I take for granted are not known necessarily by everybody. So there's probably somebody out there who's at least new and didn't know that we can treat thumb pain so quickly and easily. And hopefully, I've now encouraged you to try to find those locations. And even, like I said, even if you don't have the book, palpate and just put a needle in the muscle that's too tight or that's painful when you push on it. Put a needle in it, use some electric stim, take it out, and see what you can do. It's amazing. And people who have been dealing with chronic thumb pain are so happy to be able to get back to doing things without pain. So, it's not easy for somebody when they can't grab a doorknob or they can't open a jar with that hand. So, okay, that's it. Short and sweet. Have a great week. Take care.